Jared, we're ready.
Great. Thanks, Joshana. And thanks where people are, the numbers are racking up on the bottom, on the participant numbers at the bottom. Thanks everybody for joining this week's School of Public Health webinar. I'll wait for a second to stabilize that number of participants. There we go. It looks like we got to a stable number. Welcome everybody. It's great to know that you're here this week. I wish I could say it's great to see you, and one day we will. Just a reminder of the Q&A buttons at the bottom. Use the Q&A window rather than the chat to ask questions. And Joshana, I'm going to flip over and start sharing the other screen now. Is that okay?
Yep.
Shifted on me. Joshana, you can see it?
Yes, we can see it, Jared.
Thank you, helpful folks. Okay, welcome everybody to this week's School Public webinar. It is great to know that you're all there. It hurts my heart that we are doing this launch of the strategic plan by webinar, particularly by webinar where we can't make eye contact and talk and shake hands and hug. And talk about how all the work that's gone into making this plan, all the people who've made it reality, and all the work we've got to do because of it, and be excited about the work we have to do. This plan is what we're doing today is launching a soft launch of the strategic plan to give a preview, because it's something the school's been working on for a very long time. And you have me this week. For better or for worse, because the dean is away for a pre-planned time away this week, and so lucky you get to have me. It's great to see you all. We're going to go through a slide deck, and I'm here with a wonderful cast of colleagues and hard workers in the school who have helped to make this plan possible, and will be working all together as a team to be leading the work forward. We're going to talk through a slide deck, probably 20, 30 minutes, I think, probably on the 30-minute side, and then I'll be taking questions at the end. I will confess that it's hard to know everything that should be covered in a plan like this. So in a webinar like this, when it's a really detailed plan in the background. So I would really appreciate questions on some of the details, and really would love your emails after this is over as well. So I'm going to launch right in. So strategic plan 2020 to 25. I'll talk for a minute on how this has come to be. But first, just wanted to ground myself and ground all of us when we're thinking about what plans do. Plans are future looking, and they're aspirational, aiming for where you could be, where we could be as a school, and also they're action oriented, and we've got actions on many fronts that could take us forward and make this school an even better place, a school that I'm incredibly dedicated to. Have been here more than half my life now, and have a lot of wonderful things to say about where we could be going. We've got aspiration and action, and two really nice quotes that we put in on the future and the progress, giving all the best that we have. So thank you for inspiration. As we think about framing this discussion today, this is sort of a quick synthesis in 2 slides of kind of the guts of where we wanted to be with the strategic plan. And here's some of the commitments that we're going to that we're focusing on internal transformation of the school, who we are and what we do. And I think one of the really important things about a strategic plan is that it's not going to be a book that goes up on a shelf or a poster on a wall. It's going to be an actionable thing that changes what we are. And one of the really important things that we found in doing the preparatory and formative work for the strategic plan was people wanted both change in what we do and in who we are. So it is transformative. That we create an environment where we feel valued and respected, that we open ourselves to new ways of thinking, and there's a lot of novelty I hope you'll find in this plan that is going to expand all of our thinking, that we break down power structures and engage new voices, we root out racism, model solutions and constructive ideas, and we hold ourselves accountable. And hopefully you can feel a lot of that as we go through today. I also want to preview what you're going to be hearing in the next few minutes about actions we are doing now in the strategic plan. And this is a lot of bullets all at once, but I want everyone to feel like as we are beginning to launch, just jumping off the starting blocks with the strategic plan, there's already actions in action. Tracking back dashboards for the strategic plan itself and for the EDI roadmap. That's one of the key components that we'll hear about a few slides in. Anti-racist trainings that we're committed to deeply and profoundly and soon. The Research Council and Practice Councils that are going to be establishing research and practice priorities across the school in their own ways. Updating and revising criteria on faculty promotion, one of the things I feel very deeply about for a number of reasons, for recognizing the value of things that our faculty do. Moving into our building and consolidating new collaborative spaces, and won't that be great to be able to sit in a room with other people sometime. Implementing our faculty compensation plan and growing faculty development plan. I speak to the faculty of the school here and the commitment that we're making to each of your futures. Launching the new MPH core, I can hardly wait. Identifying new ways to break down organizational silos for cohesion and coordination, and creating measurement evaluation strategies that will listen to all stakeholders. So, timeline of the strategic plan. Here's everything that went into this plan. And I first want to make sure to thank our external consultants from Pyramid Communications who are background from somebody, one of my colleagues, that's great. Thank our colleagues from Pyramid Communications who've helped guide us through all of this. They'll be listening in on the webinar today, and they've graciously transitioned a lot of the responsibility over to all of us in the team in the school who are going to be running this plan forward. But I want you to see all the things here 1 through 5 that we've done starting at the beginning of this last academic year, including a tremendous amount of stakeholder informative work, talking to all the constituencies of the school and giving lots of opportunity for feedback on what we could be doing better, how we could be doing better, how we could be better ourselves, and then figuring out the kind of things that will make this work, the kind of work going forward. We're all the way over on the right side now in the red box and the sort of greenish box below that, where we're soft launching the plan today, with a more formal launch, hopefully in the beginning of the fall of this year, when hopefully we can spend a little bit more time closer into each other. And again, breaks my heart. We learned a lot of things in this formative research. 26 meetings, 2 town halls, surveys with hundreds of respondents. What people wanted to see was a sense of community, identity of who we are, not just what we do, an avoidance of strategic plans that are too narrow so that people could see themselves in it. We wanted the SPH to aim to be bold and aspirational, kind of like I said at the beginning, and of course a commitment to equity, diversity, and inclusion to be affirmed and reaffirmed in this plan and actually throughout this plan. So it's with humility that we all present this plan today. This plan was formulated by a whole bunch of people here in UW Purple and Gold, and there's not enough time to thank every single person on this list, but this is the steering committee, plus extra individuals who jumped in when called on to work on specific aspects of the strategic plan. I can't thank every one of them enough, and it's been really a pleasure to work with folks and to learn from people across the school who I didn't know, to hear voices that I hadn't heard before, to see representation of the totality of our school. And so thank you to all of you, and I hope some of you are on here today. And I just wanted to also point out that our strategic planning committee had challenges. The committee will know that our very first big together meeting where we were trying to kick off activities of strategic planning was during a snowstorm. And so from the beginning, we have been hit by activities that have made it harder for us to gather in person. And still, to my tremendous amazement, the Strategic Planning Committee made the activities that you're seeing today. And of course, there's coronavirus, all too much Zoom. Public health emergencies that are not just coronavirus, the decades of suffering and suffocation that are systemic racism that has also brought to the fore in the middle of all of this. And of course, the financial crisis that at some points made us stumble and say, can we really jump forward with a plan when we don't know what the world is going to look like tomorrow or next week, next month? And we felt, all of us on the committee, that moving forward with the plan was the right thing to do, because if you have a North Star and you have a course and a rudder, you're much better off in the storm than if you don't. So the North Star of this plan was written by that entire strategic planning committee to try to guide how we thought of what we were doing in the plan. And I want to read it out because every word is important and every word was deliberated over. And you know, there are a lot of academics on this, so we definitely deliberated over every word. I'm going to say it slowly. The UW School of Public Health tackles the greatest health challenges in our region and around the world. Our groundbreaking discoveries are fueled by rigorous science and equity-driven solutions. Our students are leaders who emerge prepared to work in partnership with communities to improve the health of all people. That's where we wanted to go with this plan. I hope you feel that we got there. So this is a graphical representation of the key result areas of this strategic plan. At the center of what we want is changing health for the better, so changing the public's health for the better. There are 3 areas in the inner circle that talk about education, methods and research and practice, and our internal culture, which we'll hear about, and then 2 enveloping areas on the outside, that goldish circle, that really cross-cut through everything we do and hold us all together: equity, justice, and anti-racism, and reputation and visibility. I'll talk through each of these. Each one of these has a detailed plan behind it. Each one of these has 3 outcome areas that further elaborate what each of these is about. And there's much too much detail to present in each of this. And I'm going to have some of my colleagues finally be able to speak here with me to flesh some of these out now. Just to show you, this is tiny print. Please don't feel like you have to read it. This reflects what is behind each of these key result areas, and we'll have a dashboard and other information to be able to show this all more clearly. What you're hearing today is the really distilled version of what's coming here. So taking that plan and looking now back at each one of these areas. I'm going to start here with the collective culture of meaningful change, because it's a lot about who we are. And it is a culture that supports ongoing development and growth. And you'll hear what this rhythm is when I get into talking with the 3 outcome areas as we talk through each one of these key results areas. So within this collective culture of meaningful change, a first result area that the SPH will have a culture that supports ongoing development and growth. Megan Herman from our HR, who leads HR, and I proposed to lead this with hopefully a lot of other people will be able to jump in. And some of the strategies we're going to put into place are best practices for staff development and onboarding, greater stability of faculty salary support, and innovate a new comprehensive faculty development plan. Outcome 2 is student-centered culture, led by Juanita Ricks, to roll out consistent services across the school, increase student involvement in decision-making, and develop student-centered pedagogy, something that I'm really passionate about. And our third is that the student will have a culture of well-being and connection, led by Uli Haller. And this includes things big and small, moving into our new spaces in this next year, reconnecting once COVID passes during the 5 years of this plan, hopefully earlier than later, and developing a place where we're living what public health is. I'm going to show a few of the things that we're going to anticipate now in the next year, and I would love Megan, Juanita, and Uli to talk to some of these. um, and I. Maybe I'll say the first one, implement a school-wide plan for faculty compensation. Megan, you want to talk for 1 second about the staff development?
Yes, I'd love to. So yeah, we'll be bringing together as many folks who are interested to join us in thinking about what best practices already exist across the school and departments and units and programs, and then see what kind of plans we can come up with together as best practices across the school. I think there's going to be a lot of traction on this, and I'm really looking forward to working with everybody.
Thank you. We've got a lot of efforts aimed at developing a faculty development framework, and I'm committed to rethinking what it means to develop as a faculty member, both starting out and all the way through this career path that we choose as faculty to go on. Juanita, a couple bullets here on student-centered services. Do you want to talk to them?
I'll unmute and do that. Yes, absolutely. You know, I think that similar to the work that's happening in HR, there are a lot of really promising practices and best practices being used across the school. But what we'd like to do is have a firmer understanding of how we can expand those so that the reach is to all students for best services and best practices, and make sure that we're being guided both by what we know works in public health and what we know across student affairs in general is really what we should be doing and what we should be aiming for our students.
And thanks to both of you for coming on, for popping on. This is such a difficult way to speak to people, but I'm glad I don't feel quite so alone in the void right now.
Sure.
And then the last point, I don't know, Uli, if you want to speak to this, is our community work, particularly community work related to EDI principles, but also as we move into new buildings and new digs come this next fall.
Yeah, and I think beyond the new digs, this is about treating ourselves as we are trying to teach other people how to treat other people and to apply the principles to ourselves so that people really feel supported and engaged in this community wherever they're coming from.
Thanks so much. So that's the first key result area, collective culture, meaningful change, and a lot of goals there about us. Second is a key result area, about education. Our dynamic and supportive learning environment attracts the next generation of diverse leaders who go on to drive transformational change in communities throughout the world. Again, three outcomes here, three big outcome areas here. The first, the SPH will offer consistent academic, professional, and personal support across all degree programs. And Juanita, to make us drive forward here. To coordinate and operationalize student services and student access, and that students will access and use these services. They have access to and will use these services. The second, that the SPH will adopt best practices for student financial support, where students have the support they need to complete the degrees that we promised that they could do. And I can't think of any, more central thing to that than the folks who have committed their time to come and be in our place and be part of our family and grow up and grow out of here and be part of our alumni family. So we'll develop practices for student financial support, led by Carrie Farquhar, who is poised to come back here from her time away any day now. And then outcome three, the SPH will deliver high quality based education across its degree programs, which will be led by India Ornelas, who is the director of our novel MPH core, and who unfortunately cannot be on here today because of a previously scheduled meeting. But she has a lot to say about this opportunity for better evaluations of our courses. As faculty, TAs and students know, we have lots of directions that we could go to better evaluate our courses, to have better developmental opportunities for teaching assistants and for faculty, and then better mentorship programs so that faculty can become better teachers, because pedagogy is one of the things that we could do a lot better in doing. Juanita, you might have a lot to say on the next slide because of our three leads. You're the one who's here or in this country at this moment.
Sure. So really, again, back to what we know about the discipline and how we can kind of evaluate our baseline. We'll need to do that as a starting place. We'll need to understand what we're doing well, and then really kind of scaffold that. One of the things that was mentioned in culture, student-centered culture, was student leadership. And so having students really central to this work, involved in this work, leading us through this work. Sometimes the unknown unknowns are not unknown to our students. And so really engaging them and hearing their authentic voice in a process that transforms the school into a place where they feel important and will thrive.
Thank you, Anita. There are several bullets on here that we sort of touched on the last slide too, but I think when we think about education for leadership and transformation, it makes me really excited to think about what we can be as a school and as a school, as a degree producer, and as educators, every one of us, and learners, every one of us, all the way through our time. So much more to come here. Really excited.
And just to throw in, of course, we're talking about both inside and outside of the classroom. So really kind of endowing this throughout the school's culture, not just instruction, but in all of our interactions.
Thank you, Juanita. It's one of the things that I've spent a lot of time talking about, is that we are educating, really, and one of the great things about having this kind of job is we are being educated and learning all the way through our lives. And there's a lot of non-classroom work that I do with some of the amazing students who I get to work with and learn from year after year, in lots of different things, in the field, in the field, in the discussion in the office, in the bazillion of Zoom mentoring meetings I'm doing now, all of them together. Thanks. Okay, third area, methods to research to practice, a continuum. Really happy that this evolved organically out of the process. This is something that seems to be really important to a lot of people in the school, and I was really happy to see people clamor for this, both faculty and staff. That continuous learning and rigorous science fuel our work. Collaborative science research leads to cutting-edge discoveries that we apply in ways that ensure healthier communities. Every outcome loops back and informs new ways of discovery. So this is about the deep methods that many people in this school do lead to great research. That's a lot of the core of what the school does, that leads to amazing academic practice, and practice then that occurs under communities, that helps ask new questions, that leads all the way back to the beginning. And we all care about it, and we all do great work that's respected, because it leads to what we're looking for in the ultimately, which is the improved health of the public. Three areas here, and they focus sort of on this continuum and then different components of the continuum. The SPH will celebrate important work across the continuum that leads from methods to research to practice, from fundamental methodologies to the development and implementation of evidence-based strategies to understand and change complex health systems. I, along with Ali Rohani Rabar, who may or may not be on, he had a doctoral defense that he was at, which is great.
I just joined, Jared.
Oh, good. And I hope they passed. Yeah.
And they did pass, yes.
Woo. Congratulations to whoever that was. Big day. That we're going to be initiating school-wide conversations about defining what it means to be successful across this whole continuum, because it's the whole continuum that makes us good at public health. The second area, the SPH will continue to conduct cutting-edge work in methods and research, with priorities implemented according to a roadmap defined by the SPH Research Council. The SPH Research Council, convened by Lisa Manhart, the Associate Dean for Research, this last year, with a great number of volunteers from across the school, is already developing some great plans for what the research priorities for the school will be for the next 5 years, and I can't wait to hear what they're going to do, and particularly how that research works intersects with the EDI roadmap that we're going to hear, that we all know about, and we're going to hear about again in a few minutes. And then finally, at the third outcome, at the SPH, deep collaborations among faculty, staff, and students and stakeholders result in successful models of academic practice. Janet Bateman, Associate Dean for Practice, will lead this and will be first thing creating a new practice council that will speak across all of the various elements of practice work that we do in the school, and then expand practice collaborations that reach right into the kind of community and population impact that makes a difference in health. Ali, if you want to, since you're on, welcome again. If you want to speak to the first or second bullet points, and then Lisa and then Janet.
Sure. I think one of the recurring themes, so hi everyone. I just joined after the defense, as Jared mentioned. I think one of the recurring themes that emerged out of the work of the strategic planning that has been done so far was the idea of creating an inventory or understanding our baseline, if you will, or where we stand. And this is probably a concept that has been touched in the past 20 or 25 minutes when I was not on. And this area is no exception, meaning we should start with a conversation at the school level. So this is a school-wide conversation across all departments, and everybody is a stakeholder here, essentially, to really understand what we are talking about when we discuss this continuum of methods to research to practice. As Jared mentioned, there is a lot of talent in school right now. There are many individuals who fall somewhere in this spectrum, but the question would be how we could actually create a common thread and integrate these three within our school and in collaboration with our communities to make this as powerful as it can get. Along with those, also, the goal should be to revise and update the faculty handbook to really try to align as much as we can our promotion criteria to define excellence in scholarship that, again, is aligned with that continuum that we are talking about, not in silos, not very disparate or different from each other, but rather all well connected to each other. So these are going to be some of the foundational conversations that Jared and I will have during the first year as part of outcome 1 that he just described. So I'll stop there and ask Lisa to talk about outcome 2.
Thanks, Ellie. We set up the SPH Research Council this past fall, so you actually have one. It's comprised of the research director and the research administrator in each department, plus research administration staff in the dean's office. And as Jared said, we've been working for several months now to identify and prioritize a variety of activities and priorities that we can engage in to support and strengthen research in the school. So in this first year, the Research Council has been tasked with developing what's been called the Research Priority Plan. This will be a roadmap that's modeled after the EDI roadmap, and it also will be tied into the EDI roadmap, making sure that we are also working as hard in the area of research toward achieving EDI as we are in the other aspects. And we will, the Research Council will not only meet to work on this, but we will also be reaching out to faculty, students, and staff across the school as we get this into place. And I'll stop there and go to Janet.
Hi, everybody. I'll just comment quickly on the outcome number 3, which relates to academic public health practice. So maybe many of you don't know that academic public health practice is actually a thing in our School of Public Health. And it's kind of the last phase of that methods to research to practice continuum as far as our work goes as academics. What we've decided to do, so let me start by saying what I was going to do earlier this year was to create a public health practice advisory committee. This was pre-launch of the strategic plan. And Hillary and I came up with a whole, plan to get all these practice folks together with us to help advise us on various things related to school. And it ended up being the worst possible time in our lifetimes to try to recruit public health practice people to do anything other than respond to COVID right now. So Jared and I put our heads together as the strategic plan came out and thought, hey, what we really need to move our strategic plan items forward with regard to this outcome is a practice council that would parallel the research council that Lisa just described as having been launched back in the fall. So this is currently our plan. I'm excited about it. It would start as an internal group of School of Public Health folks, similar to the way the Research Council is, but then over time, ideally, we would expand that to include these practice partners once they have a little bit more time to engage with us. So I have a draft mission and activities that's been shared with the deans and the chairs. So that's under review right now. And the mission says to support and facilitate academic public health practice in the School of Public Health, and to act as a focal point for communications regarding academic public health practice in the school. And our early activities would include defining what academic public health practice is in our schools so that people know what that means, what is currently being done in this area across our faculty, staff, and students, and then where the opportunities are for us to do more with our practice partners.
Thanks, Janet, and thanks to all three of you. This is obviously there's a lot of this key result area encompasses a lot of the work that people do, a lot of the jobs that people have in the school, and it's great to be able to talk about the work and how we think about it. Okay, continuing. Okay. Continuing on with the two enveloping areas. This is the one on the left: equity, justice, and anti-racism. We are an academic institution that promotes good health for all and breaks down the structures of racism. Again, three outcome measures here. The first, I think it goes without saying that we have an incredible EDI roadmap that was developed and launched this last year, and now it needs to become existent. It needs to be implemented in full. So our EDI roadmap is implemented and progress is shared with stakeholders, increasing our visibility and reputation as a school that prioritizes equity, diversity, and inclusion. Victoria is the lead of that as the gardener of the EDI roadmap, and we will be tracking that. And I mentioned at the beginning, one of the activities is actually a dashboard to be able to track the implementation of the roadmap. Secondly, with guidance from community members, the principles of anti-racism are adapted into our public health work. Again, with a lead from Victoria, that we will define what it means for a school of public health and this school of public health to be anti-racist, and how we can aspire to be there. We have a long way to go, obviously, but we are aspirational in this plan and committed to this plan to be able to create best practices for undoing institutional racism, for intergroup dialogue, and restorative justice training. And then the third, the structures and policies are in place at the school and improved to facilitate the recruitment and retention of underrepresented faculty, especially those who identify as Black and/or Indigenous. And several of us are leading this because of for faculty recruitment and AHR activities, that we will recruit and retain faculty and staff and provide the resources to make that happen. Victoria might want to speak now to a lot of these activities that we are planning in this year one. I'm not hearing you. Oh, there you are. Victoria, I do not hear you.
Can you hear me okay?
Perfect.
Okay, all right. My headphone wasn't working. Sorry about that. Yes, there's a lot to do in year one. And as you know, our EDI roadmap is a good guide to help us get there for sure. If you haven't looked at it, There's a lot in there with regards to curriculum, recruitment, retention, climate, data that we set out and set forth as goals for our school across the departments and programs. And right now it's going to be updated because we have to update it with the new information of what has started, what is still waiting to begin, and what is already almost done, if any of them are completed. So that's how we plan to track the roadmap so that you could see which one we need work on, we need help on, etc. And hopefully that can happen over the summer or, and it's gonna be developed along with the strategic plan dashboard. And on the second and third, the second and third bullets are pretty much related. We had our first meeting of our SPH EDI committee yesterday with regards to anti-racism training. And there's folks there that volunteered to be involved. So we're very, very happy and excited to see what we can come up with as a group in terms of what does success look like for us. And I also want to put out to all of us, what does success look like in a year, in 2 years, in 5 years, which is the end of the strategic plan, and in a generation. What would that look like if we kept doing this? And on and on and on. And so I think when we think about changing the climate, we have to think really about starting somewhere and moving along and knowing that it's a long-term work that we're trying to do. Not to say that we are not going to start, but it has to start somewhere. And we're very happy to be in a position of really, it's like a really quick learning for all of us with regards to anti-racism. And, the work is ongoing. And I think as what I will say to people is that, do the work. We're not there yet. We're not calling ourselves an anti-racist SPH at the moment. And we are working on this. We have to go through our understanding, our school-wide understanding of what this means. And so and on behalf of the EDI committee and the dean and the leadership, we invite you on ongoing conversations around that. Some of the work we have to do on that, and how are we going to support the Anti-Racist Center on Health, and the director for that, I'm hoping that that's going to happen this year. So we can even be more robust with our anti-racism programming if that's part of the work and the interest and strategic plan of the center. Along with, of course, increasing our networking opportunities and working with faculty and staff who identify as Black, Indigenous, Latinx, peoples of color. We have a lot of work to do. We have some affinity groups, but we need to continue to work on that. So it's a lot to do in year one. We have not sent an official announcement, but I am not doing this alone. We do have help from other folks, and you'll hear more about some of the support that we're getting from faculty, i.e. very happy to have AWA to help us and to support us, AWA Kone to help and support us in some of this work. I'll be sending more information on that as well. So happy to answer questions if you have any questions or comments.
Marvelous. Thank you, Victoria. In creating the visual representation of this plan, it's really important that this work, justice-oriented work, cuts through everything else that we're doing, and it's a lot of the reason that many of us went into public health in the first place.
Yeah.
Thanks, Victoria. On the other side of that circle, the last key result area is reputation and visibility. And the goal statement here is that we're recognized and highly regarded for our transformative impact throughout this region and around the world, telling our story. So 3 outcomes here: the reputation and visibility of the school will increase through use of a unified narrative that communicates the school's strengths, expertise, and unique programs. Jeff Hansen and the communications team lead this to develop a unified narrative of the school and standards and guidelines to best communicate out who we are and how we do work that is transformative and impactful. The second outcome, that we will coordinate and align marketing and communication activities to deliver more effective messaging of the real world impact to our audiences. And in that, we will develop shared marketing and visibility resources and maximize marketing and communication activities across the school. And then third, that public audiences and alumni will be meaningfully engaged in the SPH community and giving back, because that is an indicator of ongoing engagement. Megan Ingram, who leads our advancement work in the school, will be leading this effort. And that includes our 50th celebration year coming up right now. Plan for unified alumni relations that will cross-cut engagement of alumni for lots of different things, and then furthering the fundraising efforts that are benefiting students. One of the things that's a real passion for Megan and her team. I think Megan's on the speaker type list here. Megan, do you want to speak to a few of these, because you led this, you led with others this entire KRA development group.
Yes, happy to. Thank you so much, Jared. And hi, everyone out there. I wish I could see all of you. Yeah, so this is a very high level outline of what we plan to do in year one, and just know that underneath each of these bullet points are multiple layers of work and engagement that will go on across the school, across all departments and programs. But if you think about our outcomes, the way I look at them, the first one about a unified narrative is really an external facing outcome. So we need to really decide in a way, what is our identity and how do we tell our story? And how do we tell our story in a way that inspires people with the impact that we make? So those first two bullet points are really approaching this external facing outcome to find this through line that really connects us together as a school for external audiences. But at the same time, honoring the uniqueness of our departments and understanding how they best integrate into this narrative. That third bullet point is related to the second outcome, which I really see as an internal facing outcome. And that's really about developing methods and systems to better integrate the communications teams from the departments up to the mothership of the school. How do we streamline that activity, understand that activity, and support and enhance that activity in a more coordinated way, and which really supports our first outcome of this unified narrative. And then the second two bullet points there are related to outcome number 3, which I really see as our opportunity to build community. And that includes a community outside of our internal community so that we're more inclusive of our alumni, but also community members who have an affinity with our mission. How do we bring them in? And how do we engage them in a way where we can prove our value and demonstrate impact? Because those are the two things at the end of the day that inspire people to invest. And investing in our school financially is an important element of our success relative to all the other KRAs, frankly. So really happy to be part of this and to be on such a cross-cutting KRA, as it really touches all the other ones as well.
Thanks, Megan. So thanks to Megan and Jeff and the advancement and communications teams, because there's a lot of work to do here. We're all going to be talking together. So that is the narrative of the plan. Look at it one more time. A couple more things. There's a lot of things that are common, that were common themes in the formative work and are intersections within the plan. Justice, anti-racism and equity, mentorship and professional development for all of us in the school, respect across the research and practice continuum, to build an exceptional and cohesive school, to tell our collective story, to track practice to outcomes, to work in partnerships, to listen and make adjustments along the way, and to measure and evaluate and hold ourselves accountable. just want to call out partnerships because it came up over and over again when we talked about where we would want to be as a school. It defines a lot of what we do in public health because we work in a multidisciplinary way. We work on work that's both within our space and in our computers or in our offices, but also operates really in the health of the public. And we often work in partnership with communities, be they here within King County or on the other side of the planet. And so an additional thing that we'll be fleshing out as the plan moves forward is defining that partnerships is sort of the ultimate goal of this strategic planning initiative the next 5 years. We called it an impact initiative, and we will say that our work through the strategic plan ties together in an overarching way, focused on partnerships across our school and the UW, and with communities locally, regionally, and globally. And taking both, we have a lot to figure out in making this plan workable about what we do and who we are. And also with, when we made this decision, it was right in the middle of coronavirus time that we felt that we needed to, as it still is, but it was in the early coronavirus time, that we need the first year of the strategic plan to refine the outcomes of what this exactly means. But here are some potential outcomes that we posited as a team. That the SPH would be recognized as a leader in community partnered research to inform practice and policy for improving the population health locally, domestically, and globally. That graduates will be leaders who are positioned and prepared to tackle today's complex health issues, and will be increasingly recognized as a top SPH across all stakeholders. And this is not really a national rankings, but this is that in the communities that we talk to and the news and people who read it and say, that is a place that does good things for my city, my county, my state, this world. So that's where we stand. UW strategic plan for the next 5 years. Really fast cliff notes. I'm sorry we went on a little bit longer, but we had a lot of voices with a lot of things to say on our team today, and I'm really happy to be just a part of all of it. Thank you thank you everybody for joining, and really excited to hear your questions. Reminder, I think you have to type questions into the Q&A. Someone tell me if I'm misdirecting on how to do the question mark. Again, many, many thanks to the people across the school who contributed to the formative work to get here, the hundreds of surveys and interviews, the huge team who made this possible. I'm going to stop sharing and go to the Q&A. And I may call on my colleagues to address some of these questions as well, please. So there's a question here, mentorship is a common theme of the plan. Are there specific plans for mentoring PhD students to prepare them for careers in academia? Mentorship on teaching, science, communication, how to be a mentor? Excellent question. I would love to see that develop in some of the education pieces, and Anita can speak to this a little bit. But there are specific call outs for work that's related to TA work. So being able to be better in the classroom on teaching. Science communication is, I think, one of our great goals in this school. And we've learned in this last 3 months that communicating science and complexity in science and public health science is really important for health in this coronavirus world. And I would love work on mentorship.
Mentorship is definitely something that we'll see as well centrally to our education mission and our students developing as leaders. Certainly, we have mentorship already endowed throughout the school, but as we look at faculty development around student mentoring and mentoring practices will be a part of what we'll look at.
And I just wanted to add that the Research Council has actually identified as one of our priorities resources to support student success in research. So we haven't completely fleshed that out yet, but that is absolutely part of what we'll be working on.
Thank you both. There's a question. There's a question from on volunteering. If someone is interested in volunteering for one of these KRA or outcome working groups or the EDI committee, I think for the EDI committee, very clearly, there she is.
You just email me, vg@uw.edu, and you can join as an ad hoc member of the EDI committee.
For some of the other outcome groups or the other KRA working groups, feel free to email me and Kimberly Hay, who's on the board, and we will help navigate. Question, is there an evaluation plan that delineates the metrics to monitor progress towards outcomes of the strategic plan? YES, thank you, Christine, for holding us to this. Early in the slide deck, I showed the stuff that looked like an Excel sheet kind of with very tiny print. That is the tracking document that lays out all kinds of all of the strategies that we'll be using and the outcomes that we will use to track in half-year increments all the way through the strategic plan. That we are working on getting that into a visible, accountable dashboard that people will be able to see, and we'll be able to then track through it. And we'll be able to something like red light, green light, yellow light on whether we are achieving, making progress, or not started, not yet, not there yet. Absolutely. Question from Gary, is climate change addressed anywhere? I'm assuming that I think this is a question of the question of global climate change and its impact came up a lot as one of a theme that people wanted to see in some of the work that we're committing to. I think it's going to come up very, we were attentive in making the strategic plan not to call out research areas, research or practice areas that were too specific because of people wanting to see themselves in the plan. However, the impact initiative and work that will be going on to increase our work and partnership with populations is undoubtedly going to be recommitting to our work with climate change, because it crosses lots and lots of areas in the school. It crosses food systems, it crosses One Health, it crosses methods for tracking and spatial work and other things. So it's absolutely still in there, yes. Question, how can investigators follow a research roadway put up by the Council on Research when research is often for the things that are available? Lisa, do you want to talk about this question?
Yes, thank you. I would love to talk about this question. To date, the Research Council has not really focused on trying to establish specific areas of research as strategic areas that we would focus on, but rather we've been focusing on developing ways to strengthen and enhance the success of faculty in going after funding for whatever they are working on. So it's really not, at least at this point, designed to focus on any specific research areas, but it's more about strengthening our ability to be successful in research overall and to do impactful research.
A second question. I may have missed this, but within the strategy, what are examples of ways that you will hold the system accountable and hold individuals accountable? So I'll give some, these are only the briefest examples because I think we have a lot. I'm going to talk sort of cross-level and then some specific examples for accountability. So one cross example, you heard it both in terms of the dashboard for the plan and the dashboard also for the EDI roadmap, which will obviously complement and interdigitate. But we are committed to transparency and putting this plan out and saying, here is where we are with this plan. Here's what we intend to do. Here's what we have done. Here's what we have yet to do. Here's where we have succeeded or partially succeeded. And here is where we are not succeeding right now. So that transparency of is one example. The additional examples down now, I'll give an example down to an individual faculty level. The school has, in this next year, will be launching a new plan for faculty compensation. And the SPH faculty compensation plan includes, lays out sort of the broad, the expectations of what it means to be a faculty member and the financial support that's providing cushion for faculty members to actually do that job. In there is, in addition to the expectations that as a faculty member, I am teaching and mentoring and engaging in scholarly leadership, there is a specific expectation for engagement in the EDI work that is central to where the school is and wants to be. And that is something that we're holding people accountable to by going back and asking faculty each year, what have you done on EDI work? I can give a whole bunch of other examples. I want you, whoever, the question is gone, I don't know who asked the question. I want you to hold us accountable, and I would love your thoughts, and you can send it to me by whatever mechanism you want about how we can hold people accountable for the activities along here. We're gonna have there are obviously a lot of things to be done in this plan, but there are a lot of things that a lot of people are absolutely committed to. Anyone else from the speaker board today want to talk to any of those? Accountability? I do not see additional questions. That's good. So I really appreciate that people have been on this webinar. This is a busy time. More than 100 of you were on. This webinar has been recorded also. And so humbled to actually be sitting here and presenting this on behalf of lots of people who gave their opinions and thoughts to be here, and lucky to be working with lots of other people. Ann Tillery, who you may see on your Hollywood Squares, is from Pyramid Communications. Ann, do you want to say anything to close us out on your impressions of the school community as you've gone to work with us this last year?
Yeah, absolutely. Thank you, Jared. I'll say on behalf of our whole team at Pyramid, there were several of us working on it, my colleagues Denise and Alex and Carly at different points. It's been one of the most inspiring strategic planning processes and the most inclusive and engaged group of people we've been with, independent of the whole COVID emergence and the fact that the whole process went from being in person to online. The level of people challenging, bringing tough issues, being willing to sort through them together, people's willingness to sit in a space of openness to the planning process and letting it unfold as we wove different voices in. Hillary and Uli and Jared from the very first meeting had said when we met with them, we really want this to be an all-school effort, and hope that you all feel that it is. In terms from our experience doing this with lots of different organizations, it's been one of the most inclusive and engaged, and generally as a school community, I know that you're tackling big global issues, and the fact that you were pulled in so many different ways during this time but still managed to dig down, find the time, come together. It's been an honor. I'm really grateful. Really, really loved working with you, Jerry, and everybody, the whole team. Thank you guys, all the KRE leaders. I think you guys will implement it. I think it'll roll, and I think it'll change as it rolls, and that's the whole idea of it, and it's inspiring to be a part. Thank you.
That's right. We are just starting this out. Thank you, Anne, and thank you again to everyone who's made this possible. We are just starting out. We got a lot to do. It's a plan. It is designed to be iterative and change, and we'll make things work, and we'll think of new things that will happen, and we'll edit things along the way. But we are committed to a whole bunch of activities that change who we are and what we do. It's been great to work with everyone on this, and it's great to see you all here today. 4 o'clock. Have a great afternoon, everybody.
Everyone.